This government meeting is brought to you by Eastworks and our local cable subscribers.
Okay, I'll make a motion to start. I'll make a motion to start today's Board of Health meeting at 5:31 on May 8th, 2024.
All right, I'll second that. Amy, yes?
Beth, yes.
All right. In accordance with Mass General Law, we are required to let everybody know at this meeting that this is being recorded. We will begin the meeting with 15 minutes of public speak time, 3 minutes per speaker. Raise your hand if you would like to be recognized by the chair. Please note that during public speak, the board will be actively listening to your input for future discussion, but we will not be responding to any comments at this time. Please do not speak unless recognized by the chair, and all comments should be addressed to the board. You can also submit a question or topic for later discussion via email to the health@easthamptonma.gov email address. All right. Now that we get that out of the way, is there anyone? There's no one here for public speaking.
I don't see anyone.
Just us. All right. So approve the meeting minutes for 4/10/24. Beth, did you have any thoughts or concerns about them?
Nope, I have no concerns. Do you?
Nope.
Okay, then I'll make a motion to accept the meeting minutes from our April Board of Health meeting.
I'll second on necessity. Amy, yes.
Beth, yes.
All right. Cool. All right. So the next meeting is the collaboration with the Northampton Shared Services. We don't have any Lindsay's not here. There are no updates that I'm aware of that have come in from Northampton via the discussions that we're having around the shared service support. So there is no update on that right now. I think their health director was out of town for 2 weeks, or out of the country for 2 weeks. So hopefully we'll have something to discuss in June. There's no one's here for the mayor's office update. So Brian.
Yeah, Lindsay had a meeting.
Okay. So Brian.
Hello. Hi. I know Jackie told me that that the meeting was going to be kind of expedited. I'm not sure if you wanted me to go through my report, if you've read it already, or.
It was going to be expedited, and I appreciate everyone. I was supposed to be coaching a baseball game tonight, which was supposed to start at 6. It was canceled due to the weather. So, but in general, I think, I don't know, Beth, how do you feel? Do you need him to read his report or just kind of call out the highlights? What do you prefer?
I'm good with that. I'm good with the highlights.
Okay.
There was one thing that isn't on my update that I kind of just wanted to highlight. Recently, we just got DEP sent us an email of a permit approval, a permit they approved for Palmer Paving that's located off of East Street. They approved a permit for that company to recycle concrete and asphalt on site. So it's something that I was new to. I was unfamiliar with it. I contacted the person who sent the permit over from DEP, and they told me that it's just it's a formality that when they do approve this, they have to send it to the Board of Health, and the Board of Health has 30 days to provide any feedback. She said traditionally most boards of health or health departments are okay with the permits that the DEP processes. I took a review of it yesterday, and from what I gathered, I didn't see anything that was concerning on my end, but I wasn't sure if that's something that you wanted me to pass along to the board.
Oh, great to know, because, in my 12 years at local public health, I'd never seen such a thing. So that's one of the fantastic things I think about local health, is that you never know on a given day what you're going to get. I'm trying to think through, as you were talking, what are the concerns that might raise in my head if I was to look at something like that. What does recycling on site mean? Are they breaking it down? Could there be a noise complaint or a debris complaint that we're going to see from our residents?
Yeah, I mean, there very well could be. From my understanding, from what I've looked into, I believe, yeah, it's basically the breaking down of like large, you know, basically large, bulk size waste that's in the form of concrete and asphalt, and breaking it down on site, I believe, and recycling it on site. Because
And
I think at that point, once they break it down, it's not considered solid waste anymore.
does DEP have a number where if our residents have concerns, they can call them instead of us?
That's a good question. I mean, they probably do, but it's something I can look into. Yeah.
Yeah. So one of the things that I would suggest is to reach out to them and say, if we get calls to our office about noise or air pollution, who do we refer them to at your office?
Okay.
And then maybe even we could do a targeted mailing, Jackie. I don't know if this is possible or not, to that area and say, this will be happening during these dates. If you have any complaints, call these people. Save
That
you.
might be a good idea. Yeah.
I
Just to
can
kind of
get an
direct it.
abutters list from the assessor's office and do something like that.
I mean, I think it's a great idea, especially with Brian being out of the office and us not having a health director yet, to like try to be proactive about this while we still have Brian.
And at the very least, as typical when we have DEP mailings come in, faxes, whatever, I have folders that are appropriate for each one. We have one already for Palmer paving. We have them for other ones. I can generate a specific Palmer paving recycling and put the contact number in the folder. So if anyone calls, even, at least I can access it, or someone can access it and say, here's the number, call them.
Perfect. Yeah. So Brian, if you could reach back out to DEP and try to get that information, we can set that up before you are out taking care of your child.
Yeah, I can do that. I'll reach out to the woman who I spoke to this week. I'll reach out to her tomorrow.
Perfect. And just in case, if you email them, I don't know if you're emailing them or calling, but if you're emailing them and you want to put either Lindsay or me on it, that way if you're out unexpectedly, because I think now we're in the window where there could be an unexpected departure.
Yeah, that might be a good idea. I've communicated both phone and email with her, but I'll do that. I'll send her an email so that way you guys can be tied in too, and that way she has your contact information.
Great.
Yeah.
I love it. Perfect. Thank you.
No problem. Yeah, there was nothing else I had to add to my update. So.
Okay, so I had a question. How were the virtual presentations attended? Did you have a good turnout?
Yes, yeah, we had full attendance. The way the format that Bree gave me, or the way that she started, and I've just kind of kept it the same. We do 3 trainings all spread out within a week, just different days, different times, to give people to work around their schedule and their availability. Everybody attended. I think it's we require it for not just new operators, but for all operators, because obviously we have seen that even the season camps still struggle year to year, especially with the paperwork side.
Mm-hmm.
So it's a good review for everybody, because it's it's an overwhelming process. Like I said, we got a good turnout, and after the presentation, I sent everybody the slides of the presentation. I also sent them slides of a DPH presentation that was done like the week before mine, so that way they could look at like more breakdown of like what was, because they just made some new amendments to the code. They added some things in, some policies, and just added some language in. So I gave them that presentation so that way they could look further into like what was added into the code. Yeah. As I was saying in the emails with Lindsay and you, the deadline is next week. I haven't had an application hit my desk yet. It's shake your head. We shake our head every year with this
every
process.
year. It's been like, I don't know why this is particularly challenging, but it has been my entire career at public health. This is a pain point forever, even though the code is so clear on the deadline. I mean, it's written into the code. Yeah,
it very is. And, and I really emphasize too that really the bulk of everything that the state requires are like your basic general, like policies and procedures of everything. And a lot of that stays the same every year.
Every
So
year.
you once you get it right, you should be able to have a format to transition it easy every year. But everyone, I think it's just so much that everyone just gets so overwhelmed and they overlook due dates and things get submitted incomplete. And it's a process. So I'm really, really crossing my fingers that I start to see some applications within the next, hopefully by Monday or Tuesday.
Well, hopefully Lindsay's email that will go out this week will cause some like, oh shoot, we really need to get this done.
Yeah, definitely. I think hopefully that'll help. But usually, like a notification from the mayor's office usually tends to hold some weight. So,
unlike the people approving their permits, I don't know.
I know, right? I know.
Okay.
I think I might have said it in the last update, but I have it scheduled to inspect Williston's pool at the last week of May.
Mm-hmm.
I do plan to inspect their dorms that are used for the residential camps June 3rd. That's the earliest I can do it because all of the kids that attend school there are there until June 1st.
Okay. Do you go into every dorm?
I don't go into every single dorm. So I only go into the dorms that the camps that Williston says that the camps are going to use. And there's a lot of rooms. So I typically check all of the bathrooms, the shower rooms, making sure they're all working. And I usually do a spot check. I'll usually do like 5 rooms each floor. And just kind of highlight anything. I usually check like the lights, the outlets, the windows, the screens, make sure everything's
signs.
Yeah. So I'm hoping, like I said, Emily, if the baby doesn't come on its own, I'll be out by the 14th.
Okay.
So I'm hoping, hopefully we can, I can squeeze in that inspection, at least for the dorms right before, I leave. There are 2 other pool inspections. That's Town Crier. It's a semi-public condo. Yeah, they have 2 large pool and a waiting pool, and then Nonatuck's pool as well. Usually those are open up late June.
Do we know if the construction will be done by late June?
That I'm not sure. I haven't had an update from Sam or John yet from the recreation department.
Did you reach out to Sam and John, CC me and Lindsay? And
yeah, I drove by. Actually, I gave Christine, our nurse. I gave her like a quick tour of where all the camps were last week. We drove around, and I drove by the pool area, and it still looks like there was very active construction going on. So I'm not 100% sure if it might be ready at some point this summer. Who knows if it's going to be ready, at the beginning of the summer. But yeah, I can check in with them as well.
Perfect. I think it will help to know the ETA. So while we try to find someone to cover for that, we'll have a better timeline. And also they'll have a contact for me and Lindsay. So as they open, if it's like July, they'll know who to contact to try to make sure they are able to get a pre-operational inspection in a timely fashion.
Yep.
Perfect. Not that I have any anticipation of doing any inspections because it's been 2 years since I've done a pool inspection. The code hasn't changed for pools, has it?
No, nothing's changed for the pool. And the checklist that we have is the inspection form's pretty easy to follow.
Yeah, the pool does have a really good template to follow. It's nice. Now, why couldn't they do that for everything?
I know, right? Especially food. Food's always there's
no Brian. I promise you, it's coming. Coming.
Because I know there's pretty much like a checklist. We have a formatted inspection checklist for almost everything except food.
Yeah. Well, when that new data system rolls out, you're going to come back and be like, it's a whole new world.
Oh, I'm excited.
All right. Well, thanks for your update. I think those are the only kind of questions I had.
No problem. Thank you.
Yeah.
I have a question.
Yes.
Sure.
Going back to the concrete recycling thing, you said that the board has 30 days to give feedback, but we don't have to like formally approve it, do we? I'm just asking in case we need to move this to the next meeting or what.
Yeah, correct. No, I confirmed that yesterday because I had the gentleman who initiated the permit with the DEP. I had him contacting me, and he believed that he needed Board of Health approval as well. So I was getting a lot of emails and phone calls from him. So I confirmed it. I reached out directly to the woman who sent me the permit from DEP, and I confirmed there is no official approval. It's essentially just feedback or concerns highlighted. We have 30 days to respond to it.
Okay, great.
Yep.
Do we need to issue a permit for that? You know, like how permit trash haulers?
From my understanding, no. But when I reach out to her again, I'll just officially get confirmation for that, just so we can make sure
Confirmation
everything's.
from a state agency, Brian. How long have you been at this game? They're not going to give you.
I know, right?
Information.
I know they'll give me some kind of answer where there'll be 10 more questions after that. Yeah.
You know, I hope that you get a nice answer.
Yeah, me too.
I can say that with love and kindness because I understand the limitation. But okay, all right. Thanks so much.
No problem.
All right. And Liz,
I'm up.
you're up.
Yeah, I'll do the same as Brian. I don't need to read you guys my whole report. The overview is that housing is just like my phone rings all day, every day. Easthampton residents, evictions, rent issues, people buying multifamilies and evicting the people that live there to renovate the buildings. Where can we go? What can we do? And this is just people of all ages, families, seniors, students. It's constant. So I'm going to like any and all of the housing meetings and just continuing to meet with providers around like funds that are available and new properties that are opening up in Western Mass and what's available to people. And Springfield Tech hosted a big housing forum earlier this month that I went to, and it was like the governor's people from EOHLC just talking about like what housing and the crisis is looking like for Western Mass. So that was really good because it was like an opportunity to talk generally about like, everybody is in the same boat, unfortunately, and like how to best support families and older adults. And the Senior Center is hosting a forum next week specific to housing on older adults. So I think Chris is going to, but I'm going to go to that. Just, same thing. It's just getting people together to keep the conversation going. So it's frustrating. I know residents are really frustrated because there's only so many places you can turn to for funds and different things. But, hopefully I'm getting people connected to any and all resources that we can. And the schools have been really great when there's students involved. So it's just, it's kind of a day to day, but it's statewide. Everybody's in the same boat on that. So that's the like biggest topic by a long shot. Getting some of the same ongoing stuff, office hours at the library. We're doing the overdose vigil planning. That'll be in August. Monthly veteran lunches at the Congregational Church. We're going to do a summertime event for local veterans and their families. Trying to help Brian with some of the housing inspections that are outstanding that need some additional support. So there's a couple cities and towns around us that are also now getting into hiring either community social workers or community caseworkers. So I started talking with some of the people that are doing the same job in other communities. We're going to try and get a network established for Western Mass to.
Cool. I love it. Liz, contact me at the state and we'll set up, we'll help you connect so you guys can form your own little statewide group.
Yeah. So originally when I started, the Boston group kind of took me under their wing and let me pick their brain on things, but all the resources they were sending me were really far away. So I met with the community social worker for Pittsfield today. I know Westfield hired a substance use prevention person, not necessarily in a social work role, but for a lot of outreach. So I think West Springfield is hiring a community caseworker. We're just trying to get the group of us that are out here connected and sharing resources so that, everybody feels like they have a team. So that was good.
That's so exciting. And I think, we're recording. I don't know how many people watch this, but if they do, Easthampton is just so lucky to have some quality environmental health controls, which is what people think of as the traditional local public health services, but also these great services that you're bringing to our residents. 45 residents served in a community our size in 1 month. It's just exceptional work. And it's bringing services that our health department should and can be offering, and the support that we've gotten from our mayor and our city council to be able to do this kind of work is just, so I see it across the state, and it's not given everywhere. And I think, not only that, but now you're like creating additional resources to like support our residents by using resources that maybe are not available here, but by talking to Pittsfield or West Springfield or other areas that you now have access to. It's just incredible work. Nice job.
Thank you. Yeah. I mean, I feel like a lot of the people that I talk to every month, like there's a fair amount of carryover, but I consistently have a number of new referrals every month, either self-referred or like, hey, my neighbor told me about you, or, I heard from the school. Like, I do think people are recognizing that if they're looking for community support, that there is an option. I got referrals this week from Lindsay that people had reached out to the mayor's office looking for us. So it's been busy, but all good stuff. So I'm excited to talk to the other people doing similar roles in neighboring communities, because I think it'll be, it's a good way. Like, we have a network for Western Mass Housing. We have a network for Hampden County has their own. Like, I think it would just be great to be able to say, like, municipal case managers, substance use prevention, social workers. Like, it's just a good group to get together. So
yeah, it is. It
Yeah.
is. Nice work.
Other than that,
I had 2 questions from your update. What date, so in case people are watching, what date is the International Overdose Awareness Day Vigil?
so it is August 26th. It's a Monday. We intentionally don't do it on the actual date because so many communities do the 31st. So it's going to be at Millside Park, which is where it was last year. We're doing it with Learn to Cope. Last year we had a food truck and a bunch of resource tables. So we're meeting next week or the following. And I have our save the dates together. So we're going to start to put those out around the community to put it on people's radar, because so many of our neighbors do events, which is great. We just like to make sure that people are factoring in Easthampton as an option too.
Awesome. Hey, Jackie, for June's meeting, could you make that its own agenda item? That way, if anyone's looking at agenda items, they'll see that we're going to discuss that specific topic, and it won't be buried in Liz's update. And in the agenda, if you could include the date of the event. So discussing the
August 26th.
Yeah, that way it will all be right there. So people don't even need to come to our meeting to know what is happening and when it's happening.
Great.
Yeah, awesome. And the other question I had was the DART outreach.
Yeah.
So what does that mean for like your role? Do you actually go out to the houses with the DART team and do
So there's a handful of DART officers with Easthampton PD. And when I started, I did the official training to join the DART group. So I'm the only one that's not an officer. And then Emma Riley, who's with PD as a clinician, she's also a DART person who's a non-police officer. So we go out in pairs, and we get reports through the DART system of any responses in the community, whether it's a resident or something that happened in Easthampton, for anyone who is at risk or needs follow-up following an overdose or a substance related event at wherever they were in Easthampton. So we go out and offer follow-up resources. We have bags that we can provide to people with supplies if they're open to it. We don't leave anything behind without making contact with the person that we're looking to speak with, because we don't want somebody who might not be aware or somebody else who lives there to have the information that we want to get to them. So usually we get a couple every month. And so we kind of split them up depending on what officers' schedules are looking like. So we go out so we did a couple, I did a few with Officer Matt Rude last week, and we had a couple more come in today. So that's kind of an ongoing. But we had the DART conference last month at Hotel Northampton. So we do some ongoing trainings and collaborating with like the DART teams around us too. So it's been good.
That's great. That's awesome. I know that the DART program is such an awesome opportunity to make contact with people who might need some additional services. So
Yeah,
So-
and we when I first came back from leave, the group of us for DART, like we went over and met with Northampton Recovery Center to talk about how we could appropriately make referrals over to them and like what their groups look like. And so we also finally, thanks to IT, I have a successful Facebook page up and running. So we have a number of partners through DART that I linked with our Facebook page so I can share like NA meetings, AA meetings, what the recovery centers are doing, what the peer support centers are doing. So I think, you know, through DART and just through our general substance use and harm reduction outreach in general, there's a lot of good ways now that we can connect with residents. And I know that just because it's budget season, things with Tapestry are on hold, but they are included with the overdose vigil. And my hope is between now and then we can kind of carve out a way to get that rolling and, you know, add another service to Easthampton. Like it's just, I feel like we have so many good partners now locally that it's a great way to keep it expanding.
And can you remind me how much it is?
So they had reached out to us and asked between like 20 and 30,000 for the contract. And so for the mobile van, and then separate from the mobile van, they had reached out to share the information with us about public health vending machines that are rolling out in the Berkshires. So I know Lindsay had reached out to Liz, their director of harm reduction, just to say, we're absolutely interested. You know, we don't have a director right now. It's budget season. Like we just need to figure out where these funds would come from and how that makes the most sense. So I think as long as we keep, you know, communication open with them, like they're thrilled to come to Easthampton whenever, and they continue to serve our residents. I just think it'll be such a convenience when we can have them set up shop in town and not have to have residents going to Northampton or Holyoke to access their support.
And is that a one-time buy-in or is that an annual assessment?
I think, you know, I don't know. I can, I can send you the email that we got from them with the outline of the funds.
Yeah. So what I'm thinking is Easthampton has saved some money this fiscal year.
Yeah.
On the shortage of staff that we've had, and that if it's a one-time buy-in, we might be able, like, I would love to get Lindsay involved before the end of the fiscal year if it's a one-time buy-in, and we can use some of the savings that we've had from having a reduction in staff before we roll over. If it's an annual thing, I understand why Lindsay would want to ensure that we have a mechanism for continued support. So if you want to reach out to them and
yeah, I was just looking at the last email I had from them. Says a rough estimate for Easthampton would be about 20 to 30,000. This is flexible. I'm happy to check in more about that. DPH is interested
annually or one-time buy-in. That's really.
We are looking for opportunities to help hire staff. You know, it doesn't specify. But so why don't I can reach out to Liz, their director, and just say, you know, we were talking about this at our meeting. We're looking for exact figures.
Yeah.
And we'll go from there.
I mean, if this could be, if we are able to source this from this fiscal year, and I mean, we can't fund future fiscal years with the budget, just, I'm sure our accountants would have a field day with that. But if it's a one-time buy-in, and regardless of when we buy in, we have services for X amount of time, we might be able to save the town some money because we had this budgeted anyways without needing to find a source for it. So that might be great. If you need to talk before the June meeting to coordinate anything, let me and Lindsay know. We can, and
yeah, I'll loop Lindsay in and we can talk to their director, because I know last time the director had reached out to me and Allison. It was right after Allison left, and so Lindsay said, like, let me just let them know where we're at. And I don't know if she's had further money conversations with them, so I'll follow up with her and we'll go from there.
Perfect. I love it. Great. Thank you.
Yeah.
All right. We are at you, Hunter.
Great.
Bring us home.
Yeah, I'll also be brief on this. So Battle of the Bands, we have our band selected. I can read through my list real fast. We have DC Wolves, Modern Ego, Aurora Blues, Theater of Malum, Cora Monroe, Paul Blaze / Fail to Say, Man About a Horse, GDI, and Ramshackle. So 9 bands. It's going to be fun. My one hurdle right now that I think once I get past it will be smooth sailing is finding a PA system. I've contacted 4 or 5, I've contacted the city councilor Owen Zaret about it, Tom Peak. I talked to Lindsay about it. I talked to the person who runs Thunder in the Valley about if they know anybody. So I'm just trying to reach around to find someone who's not going to cost us a ton of money. Because we don't need anything crazy. I reached out to Easthampton Media. They said that they already have something going on that day, unfortunately. So I'm now trying to find some connections through everybody. So if anybody knows anybody who does small shows, let me know. I think that's like I said, the last big hurdle, and nothing crazy. Just a 4 to 8 channel mixer with an amplifier and some speakers. And I have microphones because I like music related stuff. I have friends that have tons of mics. So really it's just those 3 pieces of equipment that we need.
Okay.
Who handles that for Mill Pond Live? Who does all that stuff for the bands when they do are people responsible for their own stuff?
Yeah, I think from my understanding, yeah, I could be wrong though. I know, so it depends how big the shows are, of course. I know Thunder in the Valley he gave me some small contacts to get in touch with, because he said that his thing costs thousands of dollars to run, because it's a big event, huge event. And we don't need anything like that. So I can reach out though to Sam. I think Sam from Parks and Rec would probably know that Mill Pond Live question, right? Yeah, and I've been kind of holding off on asking the bands, but if I don't hear anything back by anybody by Monday, then I'm gonna start asking the bands if they themselves have PA equipment or if they know anybody, and see if we can. I know bands share equipment throughout the day. Sometimes a drum set, for example, they'll just have one drum set set out and share that. So, if there's something that can be worked out with one of the bands too.
And what day is the Battle of the Bands?
July 20th. So we do have time to figure out a solution to this.
Okay. I have a couple of ideas. Number one, I wonder if Williston would be willing to donate.
That's a good question.
And I have an inside track to the school, as my wife is their library director. So okay. I could inquire on that. My other thought was I have a good friend who is a DJ and does tons of weddings and things around town. Anyway, known him for years, and I could ask him as a favor as well. But I thought being a local event and asking Williston might be nice. So those are my thoughts. I'm happy to inquire about that if you want.
Yeah, I would really appreciate that. Both options sound great if they were to come through. So we can start with Williston, and then if that doesn't work out, maybe message your friend.
And it's really you're talking small scale, one soundboard and a couple speakers.
Exactly. Because the bands have their own amplifiers. I just need a microphone set up for the singer and potentially just the drum. I'm not too worried about the sound from an amplifier because that's going to carry outside pretty well, but the other 2 parts, yeah.
When you say drum, what do you mean?
So miking up a drum kit. So miking up a drum kit, you typically put a mic where the snare is and where the bass drum is. So it's 2 or 3 different mics that you'll just position next to the drum kit, and then it's the same system though.
Okay.
Yeah.
So maybe, how about this? Would you mind emailing me specifically what you would need? And then I can.
Yeah. What you described though is what I need, but I can still send you that email.
Well, I guess that you said you had microphones, but now
Yes.
then you're saying you need
to mic up. I'm just really ignorant about this.
Yeah,
stuff.
sorry. So I do have microphones. The microphones aren't a problem. What I connect those mics into, I don't have.
Got it.
So
You
when I
just
say
need the
miking
thing to
up, I'm kind of
connect
using
them
the
to.
verb.
Okay.
Yeah, like
I got it. All
the
right.
sound channel thing, amplifier
it.
/ yeah.
I think
Sorry.
I can handle that. No, it's fine. I'm just really dumb. I don't know this stuff.
Don't
so.
say that.
All right. I will gladly look into that
Thank
and
you.
let you know.
I appreciate that a lot.
Mhm.
Any other? All right, I'm gonna move on if there's nothing.
I think the same with Liz's program. If we could put this in the agenda item as its own item next June, it will help advertise for the event. We could put the name of the event, the time, and the date. If there happen to be any needs, we can also list that right on the agenda. Maybe like if for whatever reason Beth's contacts don't come through, Hunter, let Jackie know like 2 weeks before our next meeting, like, hey, this hasn't happened. We still need these things. We can add it right to the agenda and maybe drum up some support that way.
Awesome. Yeah, I'd appreciate that.
Sounds great.
So Mindfulness Mondays, yoga is going great. We're going to keep the instructor on for the rest of the school year because there's only a month left and the students absolutely love her. So might as well keep doing what's keeping students coming in the morning. Getting to why, that's self-explanatory there. Chris and I did a Narcan training for City Hall staff. We want to do one for the Council of Aging, and some of the staff brought up maybe doing one for the students at some point or doing one in the schools. And logistically, I'm not too sure. I have to look into that with DESE and everything like that. But that would be a great thing to do if we can do it.
Can we do it? I don't know. Maybe I think you're talking. If you need to reach out to DESE, you're probably talking about.
Not reach. I think I just kind of want to, because I've heard of other places doing Narcan trainings in school. So I think reaching out to those people to see how they did it.
Oh, okay.
Yeah.
All right. Got it.
Yeah. So, but that's what I'm working on. And then, we didn't have the Kratom presentation, which is completely fine. We'll do that next month. In Kratom news, Georgia passed some regulations on Kratom, like ahead of a lot of places, which I don't want to say is weird for Georgia, but when it's Georgia leading the way on like Kratom regulation, it's a little strange, but hey, good for them. And we'll talk more about that next month. And then one thing that I want to look into probably next month and the month after, but like look into just like what other communities are doing about disposables around. So for Earth Day, I attended a seminar on like vaping and the disposable effects on like the earth. And there was some like terrible statistics that I looked into, like Americans throw away an average of 4.5, or US throws out 4.5 disposable vapes per second. And you can line up the disposable vapes twice along the continental US. Like that's how many we throw out in a year. And they can't be recycled, even though they have like lithium ion batteries, since they have nicotine in them, and that's like harmful for your skin or whatever, and combustible and all this other stuff. They just get like tossed in the landfill and just, even though they're made out of a finite resource that should be like reused. So it's something I want to see what other communities are doing and kind of investigate what we're doing, if we're doing anything, which I don't think we are doing anything different. Just to, let's, move into a greener earth, right? But
Right.
Other than that, that's it.
Awesome. Thank you guys. You're doing excellent work. I appreciate the effort that you're putting in, and I know we are understaffed at this time, and I appreciate that you're all still carrying on with all of the work that you were doing when we had a director in the building. So I just want to acknowledge that and thank you for the work that you're doing. Beth, do you have any?
I second that.
Are there any other items to discuss that weren't on the agenda that were unpredicted that we're able to talk about?
Can I ask a quick question?
Sure.
I don't know if this is like a meeting question or an offline question. So my office was moved to what used to be the Healthy Youth office in an effort to have like an individual space to meet with people and have some privacy. But the problem is, with the assessor's office on the other side, we share a vent, and they can hear my office and I can hear their office. And we tried some white noise machines, and it's not a thing that's going to work. So I have been using like conference rooms and going elsewhere for private conversations and meetings with people. My hope was, if we're not getting a director, can I move into that space, and understanding that like if anybody needed to use like the table and the area in there for meetings or whatever. And the other reason that I thought that might make sense is because with so many of us in and out of the department, like if somebody stops in and needs something or needs to leave something, and only one or two of us is in the hallway, it just kind of keeps everybody together. I had mentioned the concerns around the current office and everything to Lindsay. She said the current issue is that the mayor doesn't want to do any office moves until the renovations are done at 50 Payson. But I'm just thinking, even short term, like it probably makes sense to keep us all in the same space, so that if residents are coming in looking for someone from the health department, that we're all close together. And I've been like popping in and using that office anyways, because I need a space that works to make phone calls and stuff. So I don't know if it's something we should just talk to the mayor's office about.
Do you need them to do any moving of anything?
So the guys from DPW were great, and they had moved like my desk and my filing cabinet and all that stuff into the new office. And I had said, like, there's already a desk and a computer and all that. The most I would want to do is just take my files out of the filing cabinet. But I didn't want it to be, I don't want to ask them to move all over again. Like, I could keep it pretty simple. I find that I'm not doing anything with that office because of the privacy component. And I know there's multiple other people in the building looking for an office space. So I think me having a space for two people in what was the Healthy Youth office that I can't totally function out of, and we have an empty director office, it probably just makes sense to move back with my regular like hallway department.
I don't see any problem. I mean, I think your points that you raise, both with the confidentiality and having the office staffed as much as possible, because, Brian's in and out, Jackie's in it. Like, people are not.
We all are, right.
Yes. So I think I like the reasons you're mentioning. I would be conscientious of giving up a two-person office space, knowing that we're going to get a director, knowing we're going to be staffed up eventually, to like sacrifice office space or to give up office space to get you back into a space that is more confidential might be counterintuitive. But with that said, I don't see any problem. I mean, I don't control the office. That is strictly under the control of the mayor's decision. We don't get to make those decisions. I don't see any problem with relocating you for the time being.
It's not like an urgent. I mean, I've just been like going to the conference rooms when I need to meet with people or do something privately. I was thinking more along the lines of, if we're not planning to get a director and we're going to partner with Northampton, like, does it make sense to just have us all in the same wing of the building again?
I don't know that that's the plan. I don't know that's something we're moving towards definitively.
Okay.
I think we're still kind of figuring out what makes the most sense for both keeping the services available for our residents, and also keeping them cost effective, and trying to be in alignment with the future of public health in Massachusetts, which is continuing the shared service model. Which is why I don't want to I wouldn't want us to sacrifice.
Yeah, and it's totally not like an urgent, immediate thing. I just was thinking, like, if the office is, if we're not going to fill it, then that might make sense. But if we don't, because we don't really know what's going on yet, I can stay put and just kind of use it as needed.
I think we probably could have you stay put in the director's office, which would serve the entire department and your residents' needs at the same time without sacrificing our location. So if you want to just check in with Lindsay and let her know that, like, we didn't have a problem with you setting up shop until we got a director in the director's space, and just confirm that that's something she is okay with. I think that would be a great next step, because I think there's no sense of you trying to take up conference space when other people might need that conference space when you could be using an office that right now is vacant. And for any walk-ins, you're available, right? I think there's just like so many trickle down benefits to you using that space that it makes sense. She may know things that I don't about the layout of our town, our city hall. So
Yeah.
I don't see a problem with it. I think it actually benefits our residents and our department. But check in with her, make sure she agrees.
Okay.
Unless Beth, you had any other concerns.
Nope. Sounds good.
All right.
Okay.
Any other items not expected to be on the agenda?
Just to let you know, I'm getting the list of the envelopes ready to send out letters to residents. I did not put Beth's name on the list, even though she's on the list and would be appropriate, but she's already here, so
Thanks.
I'm
I
not
don't need
mailing
any
one
more
after
mail.
her.
Beth, would you like to serve as 2 people on our Board of Health?
Yeah. I am
Know
barely
somebody?
able to be one person, so.
I would love, if people are watching this, I would love to get someone from like Liz's field into this Board of Health.
I did highlight clinical social workers on the list because, I mean, we have a lot of physicians, PAs, nurse practitioners, but I don't know how many of them would be willing. So I figured I'd throw the net and put clinical social workers too.
It's not even about if they would be willing or not. It's about making sure we have a well-balanced board to prioritize the different needs of our residents in a way that, you know, would complement the experience that Beth and I bring to the table. And I think we're seeing more and more that what our residents need are those like clinical social worker, more like community-based services. And that would be a great voice to have on this Board of Health. And I think it's also in alignment with the future that the state has for what local health departments do as we move towards the foundational public health services. So
Do you think if we made like a flyer saying we're looking for board members and like put it at the library, put it on our social
Love it.
media, put it
you
at-
want to do that? I love it. Put it
I'm
on.
just thinking like it might be a way to catch. I mean, we have a lot of social workers in Easthampton and I run into some of them at the library. I think it probably like they all have bulletin boards. We might as well put something out.
Let's do it. Let's do it. And if you have direct contacts for people who live in Easthampton who do that type of work, you know, active recruitment, I think is the best way to get good qualified people.
I'll send you the letter that Lindsay had written up and it's got the contact information, you know, the website information, because there's an online form that you fill out. And then it even has a graph of what the steps are.
Okay. Yeah, I'm happy to do a flyer and get it out to some places.
We're going to
Okay.
have the most well-rounded board of health in the state, guys. Love it.
Good.
All right, guys. Well, Brian, we might not see you next month. Cheers
Yeah, it's
to
a
you
possibility.
and your
Yeah,
wife.
thank you. I appreciate it.
It's such an exciting time. I know I said this probably like 5 months in a row now, but that's because I loved the time of anticipation and then like when it actually happened for when my son was born. And just it's like not something you get to experience very often. And there's like incredible joy and fear. I mean, it's going to be like so many crazy.
Oh yeah. Yeah, there's already a lot of excitement, fear, etc. But yeah, we're it's been a long journey to get to this point. So we're ready.
I'm so excited.
Yeah.
Well, we're so excited for you. And I hope you get to enjoy every second of it. So
Thank you. I appreciate that.
you're welcome. All right, guys, until June.
I will, yeah,
whoa,
should I
we
make
need
a
official-
motion?
Yeah.
I will make a motion to end today's Board of Health meeting at 6:19 PM.
I second that. Amy, yes.
Beth, yes.
This government meeting is brought to you by Eastworks and our local cable subscribers.